Just to give some perspective, this is a regular nasal cannula in which we currently use here at KMCS. It is a cannula in which can deliver up to 15 liters of oxygen to the patient. And it is the ones that are green in color. Here is the interface for the heated humidified nasal cannula. So this device is clearly a larger interface, and as such, more flow can go through the lumen here. So on your heated and humidified high flow nasal cannula, we start out at 20 liters of flow going to the patient and can go up to 60 liters. So it's definitely providing a lot more forward flow to the patient. What that does is, as the patient's breathing against that flow coming in, you're breathing against that resistance, you're increasing functional residual capacity of the lungs, because again, you're really expanding those lungs and increasing oxygenation. So it's very important that this device remains heated and humidified because it is such high flow. Things to watch out for primarily on this device is that the prongs remain in the nose at all times. Sometimes they'll slip out on the side of the face, so we have to make sure that we're keeping these prongs in the nose. Another thing to watch out for is, because the flow is heated and humidified, if it's a cold room where the fan's on, ceiling fan is on, it can cool down the surrounding environment, which then makes the heated gas in here fall out of suspension. And then you get this condensation and pooling in the tube. So be mindful of that. If you're finding a lot of rain out, contact your respiratory therapist and we will rectify that situation for you. The other thing to be careful or to monitor is this device is being run off of an oxygen blender, which takes a pneumatic source of oxygen and it takes a pneumatic source of air. So if you lose one of those components, if you either lose oxygen or lose the air side of things, this is what you will hear. So that's a situation in which you would have to call your respiratory therapist and have them come post-haste to troubleshoot the blender. Other than that, the only other alarm system on this device would be the heater. And again, if you're getting a heater alarm, it's something in which, would have to be taken care of. But it's something we got some time. So your largest or biggest concern on this is keeping the prongs in the patient's nose and making sure that they don't mistakenly pull them out, or if they move their head, that it moves these prongs out of their nose. So again, the patients need to be watched a little more closely because the equipment and the regimens in which they are on become a little more aggressive, and as such, things can go wrong a little more quickly than they would be normally. So it's just the acuity, if you will, has kind of gone up a little bit when we start using devices such as the heated humidified high flow nasal cannula.